Welcome back, everyone. Today, we're diving straight into a highly specific medical coding mystery that we're going to crack together. If you deal with surgical reporting, you already know that a single digit can completely change the entire meaning of a procedure. So, this explainer is all about untangling the sometimes tricky web of breast surgery codes, specifically mastectomies and lymph node procedures. Let's just jump right in and see exactly how these codes actually differ from one another.
All right, so here's the core scenario we're investigating today. Which CPT code should be reported when a partial mastectomy is performed with a complete axillary lymphodectomy? Now, on the surface, that sounds pretty straightforward, right? Procedure happens, you find the code. But, as we all know, in the medical coding world, when you combine two distinct anatomical procedures into one report, that's where things get complicated. We literally can't just guess here. We have to isolate each variable to get it right. Section 1. Decoding the anatomy. Okay, let's break down the first half of our surgical equation, the partial mastectomy. Our source text is actually incredibly precise about this. It defines a partial mastectomy as a procedure where only the breast tissue is excised. Did you catch that? The absolutely crucial word there is only. We're talking strictly about the breast tissue itself, nothing surrounding it, nothing systemic. Establishing that exact anatomical boundary is step one for us.
Right, so then the surgery escalates. A complete axillary lymphadenectomy involves complete lymph node dissection. So we aren't just talking about excising breast tissue anymore. The surgeon has actually moved into the axillary region to dissect the lymph nodes. That's a major step up in the scope of the surgery. We now have two completely distinct anatomical focuses on the table, the breast tissue and the lymph nodes. Keep both of those clearly in your mind as we move forward.
Section 2. Comparing the CPT codes.
Now here is where it gets really interesting. On one side of the ring, we've got CPT 19301. The text explicitly tells us we use this code when only the breast tissue is excised, totally without any lymph node dissection. But then, look at the other side. We have CPT 19302. The source describes this as a partial mastectomy performed with a complete axillary lymphadenectomy. This perfectly highlights why distinct procedural codes are so powerful. The entire difference between reporting 19301 and 19302 literally hinges on whether or not those lymph nodes were dissected.
To give you the full picture, let's just walk through the whole hierarchy of codes mentioned in our source material. As you can see, we start at the baseline with 19301, just the breast tissue. Then we step it up to 19302, which adds that axillary lymphadenectomy. But our source doesn't stop there. It also throws in codes 19303 and 19307. Code 19303 bumps the procedure up to a total mastectomy, while 19307 is for a modified radical mastectomy. Do you see the clear progression here? The codes scale directly with the anatomical severity and comprehensiveness of the surgery. Truly understanding this hierarchy is the single best way to make sure you never mix them up.
Section 3. The final verdicts.
Okay, you're going to need a really critical eye for this part. The source text literally provides the answer as CPT 1931 to our initial question. But wait, we absolutely cannot ignore the nuance we just uncovered. The very next sentence in that same text explicitly states that CPT code 1932 describes a partial mastectomy with complete axillary lymphadenectomy, which, was the exact phrasing of our prompt. It goes on to clarify that 1932 differs from 1931, which is for when only breast tissue is excised. So what's the takeaway? Even though the text gives 1931 on the official answer line, its own anatomical definitions strongly scream that 1932 actually represents the combined procedure. It just goes to show, as focused learners, we really have to read the full context to catch these incredibly fine distinctions.
By the way, if you love breaking down these hyper-specific coding nuances just as much as I do, please take a quick second to like this explainer and subscribe to the YouTube channel. Hitting that button makes sure you get these structured, daily educational updates right in your feed. Plus, your support is what helps us keep cracking these codes together every single day. So, thank you for that.
All right, I want to leave you with one final thought to mull over. Think about it. How much revenue, or honestly, how much compliance risk is tied up in just a single coding misunderstanding? When the difference between breast tissue only and with lymph node dissection is literally just one digit on a form, grasping these exact anatomical differences is absolutely vital out there in the real world. As we saw today, you have to read those source descriptions incredibly carefully to ensure accuracy. So keep asking questions, always cross-reference your codes, and I'll catch you in the next explainer.